Hi everyone, here again is Upstream Health with Ify. I hope you all are doing well today, and I hope you've been enjoying my videos, liking it, commenting, sharing it out with your friends and family. So today, based on some of the questions I got, polycystic ovarian syndrome, PCOS. Okay, so what is PCOS? So let me break it down for you guys a little bit. So poly means many, cystic, based on this condition, it's follicles, egg follicles, not necessarily cyst, more like a bag or a sac of egg or the egg follicles. Syndrome means it's caused by a lot of different things, not just one root cause. So let's look at the menstrual cycle of a woman a bit. So in this case, remember we're talking about the woman, the female component, okay, or the female person. All right, so during menstruation, right, you have your ovaries produces eggs, little eggs or follicles, or these follicles releases these eggs, and during ovulation they release these eggs, right? And then during menstruation, when there's no fertilization going on, right, what the body does is to shed these eggs as menstruation. At the time of shedding these eggs, or when the body waits for sperm and there's no sperm coming in, the eggs will degenerate. The estrogen levels at that time rises up for you to shed those eggs as menstruation. But for PCOS, what is going on here is that the follicles and the ovary, it's not shedding these eggs. So during menstruation, the estrogen is low. So instead of shedding these eggs, the eggs, which we now call in this case cyst, get clumped together and form what we call cysts. So that's why when you see it in a picture, it's more like cyst clumped together, or eggs clumped together. So what's going on here? So during in the female body, right, or in the ovary, we have hormones, sex hormones called androgens. So androgens are more like male sex hormones. Here, we female, we have a little percentage of male hormones called androgens, particularly the testosterone. So in the female body or in the ovary, the androgens get converted to estrogen. So that's why you need the estrogen for ovulation or for the menstruation to occur. So what happens in PCOS is the ovaries produces the androgens or the male sex hormones, but instead of converting to estrogens that you as a female will need, something blocks that activity. So conversion of androgens, which is the male sex hormones in the female, gets prevented from being converted to estrogen. So that's why you see individuals with PCOS, you find out that they have like this abnormal hair on the facial hair, obese, overweight. You see a lot of symptoms that you find, or some of the male sexual characteristics you see in male, you see them also in female, because they have higher male sex hormones, androgens, compared to the estrogens, right? So something actually blocks that reaction, conversion of the male hormones to the estrogen. So that's one. And then the second part is insulin resistance. So that, I'm sure that's what your doctor has spoken to you about a lot of time. So insulin resistance, what causes insulin resistance? I believe I did a video in one of my videos, I did talk about that. So whatever causes insulin resistance, like we say most of the time, when you consume high carbohydrate food, simple carbohydrate food, like the sugars, or you're eating in large quantities, or the time you eat it, or how you get your carbs, the way you eat your carbohydrate causes insulin resistance. I'm going to talk about that in a different video. So insulin resistance. And the third cause of PCOS is stress. Okay, your adrenal gland is in charge of producing cortisol. When you have excess amount of cortisol, yeah, so when you have an extended exposure to stress, your adrenal gland actually increases cortisol, and cortisol can provoke insulin resistance, right? So when we look at those three main causes, the first one, androgen, being blocked from being converted to estrogen that you need so that you can ovulate and menstruate, a lot of literature is pointing towards like GMO foods, herbicides like glyphosate. By the way, glyphosate is a herbicide that a lot of farmers use in preserving their plants, like to kill weeds, to kill bugs, or some of them actually use this illegally to ripen fruits. So glyphosate, so which means you should be careful about where you're getting your food. Like, is it realistic that you're gonna get like whole organic food? I don't think so. Like, I don't think so that you're gonna get like all your food, especially in this part of the world where we're living, that's gonna be 100% organic. We don't know where this food is coming from. So my recommendation, when you buy your food, if you cannot afford organic food, from wherever you buy it, make sure you're washing it properly, maybe with apple cider, and reduce also the exposure of what you're getting, because what your goal is to get whole food, to make your meals yourself, right? To get food that are really 99.9% closer to its natural form. That's your goal. So when we start talking about organic, non-organic, that can be very challenging. And so let's look at the other second part, which I know your doctor talks to you more about. So that's insulin resistance. So search up my videos about insulin resistance. So insulin resistance is caused by high carbohydrate diet. Not just high carbohydrate diet, how you get your carbohydrate into your system is very important. So PCOS, polycystic ovarian syndrome, I've just explained to you the three main causes and how you can pursue treatment naturally or with medication. So you should be speaking with your primary care doctor to know which one is better for you. It doesn't work like a treatment pathway doesn't work for everyone. It works differently. Okay, so I know some of like if your doctor put you on metformin, that's because they want to take care of the symptoms caused by insulin resistance. So remember, with insulin resistance, you have a lot of insulin in your blood, and that way you have a lot of glucose sitting also in your blood, and your cells are not able to take up this glucose because your cells are insensitive to the insulin that is supposed to be removing the glucose from your blood. So metformin will help your cells to be sensitive to absorb or to take the glucose out of the blood, right? And also prevent the liver from breaking down more glucose and sending them into the body. So that's why your doctor put you on metformin. But metformin might not be for everyone. So make sure you're speaking to your doctor about that. And then some patients are put on oral contraceptives, and you might be wondering why oral contraceptives. Meanwhile, one of the risk factors of PCOS is infertility. So when I say one of the risk factors, it's not everyone. I've heard stories, very positive stories of people with PCOS that got pregnant. So when your doctor tells you about infertility, it is not 100% true. It's just a risk that PCOS, because you're not ovulating regularly every month, can put you at a risk of infertility. Doesn't mean that that you can never get pregnant. Okay, so that's why during treatment, a doctor can put you on oral contraceptives. And then you're wondering now, well, I want to get pregnant. Why oral contraceptives? So remember that the reason why they're putting you on oral contraceptives is because they want you to ovulate, right? When you put on oral contraceptives, it means that they want your estrogen to go up so that you can shed those eggs and menstruate. Okay, so like I said, your doctor might put you on metformin or oral contraceptives, but the part that I'm more interested in is diet. When you use nutrition for polycystic ovarian syndrome, so what can you do about diet? So when we talk about insulin resistance, remember I told you that it has to do with how we consume our carbohydrate food. It's very important. So how you consume your carbohydrate food, like the quantity, how you're having it, the order you're having it, how you're making it, where you're getting it, is very important. And having your complete nutrient dense food is very important. So I'm going to talk about the diet in another video. So when we talk about diet to improve insulin sensitivity, it is very important both for cardiovascular health, like high blood pressure, diabetes, high cholesterol, metabolic syndrome, obesity. So you see, insulin has a lot. Insulin plays a very big role in chronic conditions or with our health, which I'm gonna also be speaking about that in another video. So if you have more questions about PCOS, you can drop that below, and if it's private, send me a chat through my Instagram page. And I hope you like this video. Comment and share it out with your friends and family. See you. Bye bye.